We're going to turn now to George Crooks, who's the Chief Executive of Digital Health and Care Institute in Scotland. George is another pioneer, inspirational. How can I embarrass him? He is a pioneer of integrated health and care. If it's been done, George probably did it first, and he was involved in the earliest stages of what was then the Technology Strategy Board's first involvement with digital health and assisted living. So he knows so much, but we're restricting him to a limited time frame. And George, will you take it from here, please?
Great, thanks very much, Ian. What I'd like to do in my little part of what is a really interesting day is give you an injection of reality. I would say that as a doctor, wouldn't I? But if you look from a health and wellbeing point of view, it's probably the largest contributor to spend of GDP in most countries around the world. But it's really only the enlightened healthcare systems that actually recognise that citizen-centred care is important, but even then we only pay lip service to it. And what I mean by that is that in each and every one of your countries, you will probably find that the vast majority of your health spend and most of the press attention doesn't go to health and well-being within our communities, but it goes on healthcare delivered in these large, very expensive disease palaces we call hospitals. But when you ask citizens what's important to them is they want to continue to live healthy lives in their own homes and in their own communities. And how do we do that? Well, what's interestingly is this move towards integrated care. And by integrated care, we're talking about a vertical integration, which is integrating hospital care and community care in a much more cohesive way. But equally and more importantly, horizontal care, the integration of healthcare with social care moving down into the well-being agenda. But what the pandemic, interestingly, has reinforced to us all is that when individuals feel enabled to adhere to government recommendations, significant positive public health benefits can be achieved, and therefore the social isolation policies that all countries have taken forward has demonstrated that it has actually reduced the spread of coronavirus. And this is called distributed cooperation. But it's actually fair to say that bureaucracies do not decentralise well. So this focus on communities and multi-generational neighbourhoods and how we can use ISO standards to underpin and really energise this whole agenda, for me is really important. What we did in Scotland is we asked our citizens what was important to them, and they told us some things that as a doctor I found rather surprising. Citizens said they wanted actually to deliver more of their health care themselves and not be dependent on the system. They wanted to stay in their own homes, and equally importantly, they wanted to give things back to their communities, but they didn't know how best to do that. They were either time poor because they were in full-time work, or in fact, for example, their families and their aging parents lived at a distance away from them, and they didn't really know how they could best support them. And clearly these are areas where digital tools and services can come into their own and actually help and support people to be better connected to families, but actually better connected to their own communities. And by communities in this context, I'm talking, of course, about geographical communities, but they could equally importantly be virtual communities of interest within neighbourhoods. So that's all very interesting, and it's interesting intellectual football to kick around, but let's look at the specific challenges that we face on a day-to-day basis. Up until now, 90% of spend on digital tools and services aren't focused on you and I as individual citizens, but they're focused on technologies that health and care organisations spend to benefit the organisation itself or those that work in it, and the patients are passive recipients of that beneficence. We're also spending millions of pounds supporting organisations to join up siloed back-end databases, and we need to continue to do that. But if we're really being serious about taking this agenda forward, we need to invest more in technologies that support you and I as individuals and the communities in which we live. And so what we're promoting in the UK, and I run a National Innovation Centre for Digital Health and Care, we're basically challenging the status quo, and we're saying, let's think about the citizen becoming the point of data integration for the future. Let's stop investing millions of dollars or euros in giving artificial intelligence to organisations and give each and every one of us our own AI that can act in our own data and join our data within our communities to allow data to be our real oil on the wheels of making communities work. And for this to become a reality, we need to understand the lived experience of us all. And we've gone around the world and we've looked at the architectures that can enable this. And what we've done is we've taken the best examples and we have built in Scotland what we believe is going to be the future ICT architecture. And what it allows us to do with a level of security and a level of trust is blend formal health and care data with consumer data, so we can get a true example of the lived experience of an individual. And what that then allows us to do is to make much better health and care planning decisions, but also allow you and I to make much better health and well-being choices. Because, as a number of you in the audience will be aware, we're putting much more focus in the future on what we call the social determinants of health. And we actually know that, in fact, the input of our country's health and care system only has about a 20% impact on our individual health and well-being. Most of it is down to our social and economic environment, our physical environment, and of course our individual behaviours. And we've matched the data points that we can currently gather about you as an individual and match them against the social determinants. And slightly worryingly for us all, that the healthcare system in your country is making life and death decisions about you based on about 16% of the available data that it could have available to it. That needs to change. So for me, we need to be designing digital tools and services that actually support us as individuals, tie us closer into our communities, empower us to give back and create added value within the communities in which we live. And by doing that, we will actively benefit our own health and well-being, but that of those who live and work round about us. Thanks very much for listening.
Excellent, thank you, George. I'm going to move straight into Faith LaGrange, who's the Director of Regional and Local Government for Microsoft, because George is advocating more tech, more digital and more intelligent tech, and I am suspecting that Faith will not disagree, but over to you, Faith.